So where can hypnotherapy be used? What areas is hypnotherapy used within? Well, obviously, you know, I can't not talk about private practice. It's what a lot of therapists decide to go into. In other words, they become a general practitioner, so to speak, where they will sit down and they will treat anything and everything that comes in, just like a GP would. Many of us, you know, I will work with anyone and any presenting condition, but as you progress within general practice, you tend to find various specialities start to become a part of your portfolio. So yes, I'm very much treat anything that comes in, but also I have a speciality in working with things like pain, trauma, and certainly the mind-body connection. I also have a speciality in a technique that is called inner child, which I apply within my trauma work. So that might be what somebody wants to do, or you might want to use hypnotherapy in business, where we're working with people within big corporations, helping them to deal with the stresses and the challenges that their particular job might bring, to help them perhaps set goals and become motivated and so on. It's often quite nice within companies where you get sick company syndrome, where there is a very negative culture, for therapists to come in and help change, help the company change that culture to something that's more positive and acceptable to the employees. And you know, there's plenty of research showing that bringing therapy, including hypnotherapy, into big business can help employee satisfaction, employee retention, and help the employees with their customer care. Obviously, there's medicine. You know, this coming Friday in a week's time, I'm talking to the neurorehabilitation unit at St George's Hospital in London, and I'm talking to them about how hypnotherapy can be used within neurorehabilitation. I've spoken to hospitals about pain management and so on. In fact, you know, we have helped create a pain management unit in the University of Malaya Hospital that uses hypnotherapy as part of their routes to working with pain. We've trained a doctor who uses hypnotherapy to reset dislocated limbs. He uses hypnotic techniques, he uses hypnotic language patterns to distract his patients in the emergency ward, and without using any medication resets their dislocated limb. And that's increasingly being seen within some of the hospitals around London. One of the earliest areas in which hypnotherapy was used was within dentistry, helping people to, you know, simply overcome dental phobia, perhaps one of the most, you know, one of the biggest phobias that is out there. But also dentists have been using it, and therapists have been getting involved in dentistry to help with pain management, dealing with people who have a phobia of needles, to manage their own pain and discomfort. I have my own experience of that. I mean, I don't have a phobia of needles, never have, but I decided once I had to have a filling, and I've been using hypnotherapy for pain management for quite a while, and I thought, come on, Peter, you really ought to try this on yourself. So I had to have a filling, and I used hypnosis to numb my jaw down, and I couldn't feel a thing, honestly couldn't feel a thing. The one major benefit, apart from not feeling anything, was the fact that afterwards I didn't have that numb lip, so whenever you tried to drink anything, it dribbled everywhere. So, but within dentistry, and there's a whole host of areas in dentistry where hypnotherapy is applied. There's things like hypersalivation, control of bleeding, connecting with dental health recommendations. You know, hypnotherapy becomes, within medicine and in dentistry, part of the certainly occupational health, and certainly in this day and age where globally companies are becoming more and more aware of mental health and mental health well-being. And so occupational health departments are bringing hypnotherapy in order to help people cope with, again, linking with the business aspect here, but helping people to cope with the pressures of their job, the more external pressures that are coming in, affecting their jobs and so on, and helping them to improve their own personal well-being and efficacy within the business environment. And an area that we're very much, we're seeing hypnotherapy move into, quite interestingly, is within the school environment and the college environment, university environment, where appropriately trained hypnotherapists are being brought in to help children deal, especially more so now. I mean, I was talking to one of our specialists, Caroline Dyson, about her workload, and she said because of COVID, because of the mental health issues that are associated with going into lockdown and home learning and everything, she's run off her feet with the children she works with. So it's about helping students of all ages cope with their mental health issues, helping the teachers who have their own set of mental health issues coming under the occupational health heading, cope with their stresses, and likewise helping the parents who are also under their particular pressures cope with their stresses as parenting and through the parenting process. So I mean, this is just a snapshot. There's so many areas that people are using hypnotherapy, physiotherapy, to be but one, as I mentioned earlier, massage therapy, bodywork therapy, and so on.